You're watching UNICEF Television. As UNICEF and its partners race to contain Haiti's cholera epidemic, UNICEF Health Specialist Mireille Tribie says the most important message is that cholera is treatable and preventable.
We are making sure that the radios disseminate to the population, and we tell them why it is preventable, the mechanisms to avoid, the good hygiene practices that should be put in place now immediately. And of course, it's treatable once the patient is diagnosed, or not even diagnosed, once the signs are apparent that it might be cholera, immediately start with the oral rehydration while you're making your way to the CTCs or a close hospital. But the important now, the population is well aware that it is a disease that you can prevent and can treat if taken in time. The Ministry of Health has worked with the communication department of UNICEF day and night, where 12 messages that are ongoing on the radio station, that are being sent to the radio station, is do not even think it may or may not be. The moment someone starts vomiting and have the liquid, very liquid diarrhea, you start rehydrate. And if the people don't have serum oral rehydration salt at home, which they might not have, they also taught how to prepare what we call the house serum. With very definite steps on how to use making sure that the water is treated water, and with, depending on the amount, a gallon or a liter, how many spoons of salt and spoons of sugar to mix in a jug, in order to immediately start rehydrating the patient while you're making your way to the CTC or the hospital. And those are really the main messages that have made a difference in the amount of cases, the number of fatalities we have, or rather that we don't have. It's a decision between life and death. The microbe works rapidly. The dehydration is very rapid. Within hours, the person can lose all of its water. And that's how, and they collapse, the person dies. So it is very rapid. So that's why now the message is do not waste time. We don't even want you to think it could be. Of course, we know there are other diseases that give the same kind of symptoms, but we don't know. So we don't take any chances. As soon as you see this sign, immediately prepare the serum and start giving the person the serum. So this is immediate, not even seconds even. No time for thinking, could it be? And that's what makes the difference between the person living or succumbing to that.
You've been watching UNICEF Television. For more information, visit unicef.org. Unite for Children.